Hello guys, good evening and good morning. So whatever time you're listening to this video. So welcome again to our online classroom. I'm glad you're watching this video. So we are now guys in section 2 of our PRMLS1. Yan. So basically, this is going to be the introduction talaga. Ito na yung introduction ng medical technology profession sa inyo. Yan. So our section 1 was about the history, the historical milestones in medical technology. And now, class, we will talk about the profession. Yan. So we will define the practice of medical technology or clinical laboratory science profession. Yan. So our objectives, by the end of discussion, so based on your modules, class, so you would know we will get to completely discuss the practice of medical technology, its nature, its relation to the detection and diagnosis of disease. So class, yun ang expertise natin, detection and diagnosis of disease. You should be able to explain comprehensively the practice of medical technology, and you should be able to differentiate accurately the practice of medical technology practice from other professions, just like laboratory technicians, pathologists, ano pa kaya yung mga work nila. So, yan ang discussion natin for today, okay? And so, let's have an overview of the practice of medical laboratory science. And so, guys, the law that encompasses our profession is RA 5527 of 1969. I think I discussed this, diba, in our first section. So, Republic Act 5527, wag mong kakalimutan yan, of 1969. And the title is Philippine Medical Technology Act of 1969. Guys, yan. Andito na naman yung mga reappeals na. So, it was updated or it was appealed. So, yung RA 5527 ng 1969, it was mentioned on the previous PowerPoint. Meron tayong RA 6138, PD 498, and PD 1534. Huwag kakalimutan yung tatlong yan, ha? So, lumalabas yan sa board exam. So, guys, RA 5527 protects our profession so that all the things that we do, other professionals, just like nurses, radio technicians, mga siling sa mga X-ray class, sa mga CT scan, some things, there are things that are very unique in our professions, and we are protected by RA 5527. Example, blood extraction, class. Blood extraction. We are the only professionals who are actually allowed or licensed to do blood extraction here in the Philippines. Nurses cannot do that. Rad techs cannot do that. Doctors cannot do that. So, practice according to our A5527, paano niya define? Dito sa batas, define niya an auxiliary branch of laboratory medicine which deals. So, anong ginagawa natin? Which deals with the examination of chemical, microscopic, bacteriologic, and other medical laboratory procedures. So, what do we do? Medical laboratory procedures. And for what purpose? Which will aid the physician in the diagnosis, study, treatment, and the promotion of health in general. So, we diagnose diseases. So, we help in the diagnosis of diseases, class, doktor ang gumagawa nun. We assist in the study of diseases, we assist in the treatment of diseases, and we assist also in the promotion of health. So class, the people who goes to the laboratory are not only sick people, but also healthy people. Example is if we have annual general testing. Ganyan. So, So, class, mapapahaba yung discussion natin dahil dito. So, the disciplines in medical laboratory science. So, the disciplines or the different sections or your professional subjects class here in this course class. Ito yung mga magiging professional subjects nyo. Yeah? So, number 1, we have microbiology. And under microbiology, we have parasitology, mycology, and virology. Class, in the laboratory, hiwalay na section ang parasitology. But microbiology, mycology, and virology, yan. Laging magkakasama yan. Yung tatlong yan. Parasitology, usually hiwalay. But because parasites are microbes siguro, kaya nakasama dyan. Number 2 is hematology. So, hematology, so it's the study of blood. Yan. Clinical chemistry, we have clinical microscopy, we have immunology and serology, histopathology, immunohematology or blood banking, and molecular biology. So guys, ang rami. Yan. Aren't you excited that you're going to learn yan such incredible things. Yan. Ang favorite ko dyan, class, is immunology. Yan talaga ang isa sa favorite ko. Pero, since I'm teaching hematology, I'm loving it. Hindi ko pa kasi yan tinuturo talaga. But, mahal ko rin yan. At saka blood bank. Yan, I like blood banking. Histopath, hindi masyado. Anyway, so we will have, as what I said in the orientation, guys, I will be basically your tour guide. Yan. So I will tour you in the practice of clinical laboratory science. Yan. So we will tour the laboratory, what will you expect? Yan. Baka may nag-enroll sa inyo, hindi nyo alam kung anong pinasok nyo. So we will learn it here. Yan. Okay. So for microbiology, so one test that we do, the common test that we do in microbiology is culture and sensitivity. Culture and sensitivity. So when we say culture and sensitivity, it includes 2 tests. So when we say culture, we grow the bacteria. Ma'am, what's the specimen used in culture and sensitivity? Class, depends on the sickness of the patient. Example, if the patient is suffering UTI, then they tend to give urine in the microbiology section. So if the patient is suspected with sepsis or blood infection, so the specimen is blood. Ganun. So sometimes they give other specimen. Yan. So they bring it to microbiology for culture and sensitivity. So for culture is we grow the bacteria so we can identify what specific bacteria it is. And for sensitivity, the second part is after growing the bacteria, we will find out which antibiotic will inhibit the bacteria or will kill the bacteria. So class, dito sa first image natin, yan. So they in this agar media, so ito class, yung glassware kung saan siya nakalagay, we call it a petri dish. And the gel inside it is a nutrient, it's a media agar. Yan, media agar kung saan nag-grow yung mga bacteria. So class, ang example, this is Escherichia coli. It has a greenish metallic sheen. Yan. So, ganyan. Doon siya nag-grow. Yan. Escherichia coli yan. So, apparently, so kunyari example, so the patient brought in urine for culture and sensitivity, and apparently, may Escherichia coli sa ihe. And then after that, we will get the Escherichia coli and we will test which antibiotic will have the largest zone of inhibition. So kung ano yung antibiotic na may pinakamalaking circumference na so that circumference is, we call it a zone of inhibition. Yan. The area wherein there's no growth of bacteria. Kung aling antibiotic ang may pinakamalaking diameter. So, meaning that's the best antibiotic for that bacteria. Ganon. So, yan, culture and sensitivity for microbiology. So, basically, class, microbiology is the study of microorganisms. Yan. So, what are your microorganisms? So, we have your bacteria, we have your virus, and we have your fungi. When we say microorganisms, so we need an aid of a microscope because they are so minuscule. They cannot be seen by your naked eye. So, class, pag-usapan naman natin itong mga bacteria, just an overview of it. Yan, para naman makilala nyo sila ng pakunti-kunti. So, class, notice that your bacteria has scientific names. Natutuwa ako kanina kasi nakakita ko ng Facebook video wherein this guy sang Bahay Kubo using the scientific names ng iba't ibang gulay. So here, class, yan, ito rin, naka-scientific names rin tong mga bacteria na to. And class, notice ha, if you're going to write a scientific name, so the genus, yan, so the first word, yung Streptococcus is in capital letters. The genus is in capital letter, yung first word. And class, the second word, yung species natin, the first letter is in lower caps or in small letters, ha? Kasi ganyan magsulat ng ng scientific name, walang magsusulat ng scientific name in all caps, ha? Lang magsusulat ng that's wrong. Yan, write the scientific name properly. So the genus have a uppercase in the first letter and lowercase. Yan, all caps. So walang magsusulat ng uppercase lahat. So class, pag-usapan natin to, interest itong mga to. So we have Streptococcus pneumoniae. So class, microscopically, it looks like this. Yan. It's a cocci, it's a diplococci. Yan. So cocci, isa lang. Pag diplococci, it comes in pairs. Anyway, so class, Streptococcus pneumoniae, this causes pneumonia. Diba? Very basic. Next class, itong mga lollipop or mga rattle, we have Clostridium tetani and Clostridium botulinum. Yan. Favorite ko itong mga to. Class, Clostridium tetani causes tetanus. Yan. So, Clostridium tetani is found usually in the soil. So, example, you were bitten by a dog. You not only need anti-rabies vaccine, but you also need a tetanus vaccine, especially if the dog is playing in the soil. Yan. So, tetanus vaccine. So, it is caused by Clostridium tetani. So, class, if you have tetanus, you are prone to lockjaw. Yung biglang maglalak yung jaw. Lockjaw. So, yan, class. Next, we have, so usually when you have tetanus, class, there is a rigidity. So, example is lockjaw, rigidity of muscles. So, next, guys, here we have Clostridium botulinum. And Clostridium botulinum. Class, this one does the opposite. So, it does not make your muscles rigid, but it makes your muscles floppy, ang tawag doon, loose is, it will lose its vigor, and manglalambot, class, when you have Clostridium botulinum. So this causes floppy baby syndrome, FLOPPY, floppy baby syndrome. So usually if a baby will eat the spores, would be able to eat the spores of a Clostridium botulinum, ayun, magiging floppy yung baby. It will, the baby will lose strength in its muscles. So, class, next, Legionella. Ma'am, i-discuss mo talaga lahat. Unang man, para may mapakwis ako. Legionella pneumophila. Yan. So, class, this one causes lung infection. Legionella pneumophila class causes Legionnaire's disease. Yan, Legionella pneumophila causes Legionnaire's disease. Yan. It was first discovered in aircon class or cooling towers. Yun ang mga gustong bahay ng mga Legionella pneumophila. Cooling towers, aircon, kung saan, wherein it's cold and it's moist. Yan. Class next is Treponema pallidum. So this one causes syphilis. Diba? Syphilis is an STD, sexually transmitted disease. In the previous discussion, isn't it that I discussed about one of its symptoms, which is a painless chancre. Yan. Class, we have Streptobacillus. Streptobacillus moniliformis. Yan. Class, I want you to search what does this bacteria causes. Next, class, we have Vibrio Cholerae. So the common name of Vibrio Cholerae class is comma bacteria, comma, C-O-M-M-A. Yan, it looks like a comma daw. So, yun, it causes cholera. When a person has cholera class, so there is diarrhea, and the stool, when we describe the stool, it has the patients who has cholera usually have rice watery stool. Rice watery stool. Parang pinaghugasan ng rice yung tae nila. Ganun pag may cholera class. What else? We have Salmonella typhi. It causes typhoid fever. Helicobacter pylori class. It causes ulcer. Diba? Basic. Kayang-kaya nyo yan. Ilan lang bacteria yan. Kayang-kaya nyo yan. Okay, next class. So we have your virus. Nako, very hot na hot ng mga virus ngayon. Class. Simulan natin. Let's leave coronavirus as last. Okay. So we have influenza. So it usually causes common colds. We have adenovirus. It also causes cold-like symptoms. So weakness, cough. We have rotavirus class. Rotavirus causes diarrhea among infants. Very common. Yan. So if your baby, yan, if there's a baby and suddenly the baby had diarrhea, most probably it is caused by rotavirus. Yan. Next class, hepatitis B. Class, we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Yan. Class, hepatitis B and hepatitis C are blood-borne infection. So class, they can be transmitted through blood transfusion and sexual contact if there is blood exchange. Yan, hepatitis B. Class, hepatitis A, class is a foodborne disease. Hepatitis A. So makukuha mo siya sa food. Yeah, they say that you can get it by eating street food, something like that. Yan. Pero class, ang hepatitis B, you will not get it by eating street food. You can get it as an STD, yan, blood transfusion, mother to child. Next class, papilloma virus. Papilloma virus, class, an example of papilloma virus is human papilloma virus. Class, it causes cervical cancer. Yan. So class, to get HPV, one risk factor of HPV is multiple sexual partners. Class, even though you use condom, but you have multiple sexual partners, class, pwedeng tinatakot ko kayo, pwede magkaroon ng HPV. So one way to prevent it is using vaccine. Yan, vaccine. Class, I want to get HPV vaccine, but as of now, ang mahal niya. Pag-ipuna ko muna, okay? Next class, we have Ebola virus. So it causes Ebola. Yan, compared to coronavirus, Ebola virus has a higher fatality rate. Ibig sabihin, mas mataas yung chance mo, class, na mamatay. So you have about 90% chances of dying. I'm computing the fatality rate of coronavirus. So far, it's low. But it's affecting so much people and it's a new virus. Kaya nakakatakot talaga siya. And class, HIV. So HIV, human deficiency virus, so HIV. So this is a sexually transmitted disease. It is a bloodborne disease. Yan. So it can be transmitted from mom to the offspring, to the baby. It can be transmitted through, pareho sila ng hepatitis B eh. Example, to sharing of needles, mga ganon. Class. So HIV, the fulminant form, ibig sabihin, the worst fulminant form of HIV, or the worst form of HIV is AIDS. Yan, AIDS. So class, when we say AIDS already, the person is starting to become immunocompromised. Yan. So the immune system is becoming really weak. Yan. It affects your lymphocytes already. Yan, bumaba na yung levels of lymphocyte pag may AIDS ka. But thankfully, guys, due to antiretroviral therapy, now class, HIV has been manageable as long as they're religiously taking their antiretroviral treatment. Pwedeng mawala. Pwedeng mag-normalize yung immune system. And, you know, it also prevents, if you are a pregnant woman and you have HIV and you are drinking ART, you cannot transmit it to your baby. So that's great news. And class, we have herpes. Yan. We have two types of herpes. So, herpes, which are sexually transmitted, yun, merong herpes na sexually transmitted. That affects the lower extremities, specifically the genitals. Meron rin yung herpes that affect the mucous membranes. Yan. Nakalimutan ko na, but basta yan, herpes actually are also sexually transmitted. Yes. So class, since coronavirus is very special to us right now, can I just discuss a simple discussion about coronavirus so that you can share it to all, diba? So class, actually there are 7 types of human coronavirus. But class, matitindi itong mga types of human coronavirus. 4 of the human coronavirus, itong mga to, yung number 1, these 4 class, COV, OC43, yan, HKU1, mga yan class, they cause common colds. Yan. So you may have coronavirus, but it only produces common colds if these are the strain that infected you, class. Excuse me. But guys, we have other strains left. So we have MERS-CoV, Middle East Respiratory Syndrome, related coronavirus, class. Severe acute respiratory syndrome, coronavirus. SARS. So there was an outbreak in Hong Kong in 2003. And class now, so we have COVID-19 disease. Yeah. So class, your COVID-19 disease is the disease, but the virus, we call it SARS-CoV-2. Yan. SARS-CoV-2 virus. So, SARS-CoV-2 will result to COVID-19 disease. Yeah. So, class, your human coronavirus are RNA virus. Yan. There are DNA viruses. They are RNA viruses, and they are covered with an envelope. Class, if you're going to look at our image, so, ma'am, why coronavirus ang tawag sa coronavirus? Where is the corona? Right. So class, the corona, class, is not a crown, but the corona refers to the coronas of the sun. Kaya daw kinawag na coronavirus kasi parang sa may sun. Yan. The corona of the sun. And class, the red portion there, the spikes, yan, mga spikes are the corona, class. So that spike is a spike protein. Yan, spike protein yan yung ano niya, the corona characteristic of the virus. Yan. So class, what's good news about coronavirus, about this virus? Class, it's easier to sterilize. It's vulnerable to heat, to drying, and UV. Ayaw niya ng tuyo na kapaligiran. So class, if you keep your things dry, yan. If you sterilize it, if you clean it, if you disinfect it, you don't have to worry about COVID-19. And class, your COVID-19 love moist surfaces. That's why it resides in the lungs. Yeah, it loves moist surfaces. Yeah. So if you keep your things dry, then COVID-19 hates that. Yun. So little fact about COVID-19. So class, so next under microbiology, so we have fungal infections or fungi. Perhaps what's in your mind are mushrooms. Yan. So class, these fungal infections are caused by fungi, and actually they are microscopic. Yan. They are microscopic and they can cause infection. So I place pictures of the common fungal infections. So we have ringworm. So class, kahit may worm yan ha, that's a fungi. Ringworm. Yan. So usually this can spread from one person to the other, ganyan, or if you're sharing linens and towels with other people. Class, we have athlete's foot. Yan. Ringworm, because the lesion looks like a ring. Yan. I don't know why there's a worm there. Athlete's foot, class. So athlete's foot, this is caused by a fungal infection. So class, kung mabaho yung paa nila, so baka may fungal infection siya. So you can use a antifungal cream. Yan, kung mabaho yung paa. So class, what else we have? So this photo, baka nagugulat ka, ma'am, pa ba yan? So that's between the toes. That's between the toes. We have tinnias, class, tinnias. So, ayun, it causes itchiness, this lesions or dry patches in the skin, tinnias. Class, dandruff is also a fungal infection. Right? And class, we have candidiasis or yeast infection. So candidiasis can be found in the mouth. Class, yeast infection can be found in the vagina. So mga fungal infection, class, yung mga yan. So you know, class, in our body, you know, we have normal flora. We have good bacteria that are residing in our skin. Yan, we have good bacteria residing in our skin. But class, if a person is immunocompromised, yan, mahina yung immune system niya, if the person is taking too much antibiotic that it's killing the body's normal flora, class, fungal infection tends to go out. Yan, to appear, yan, to manifest itself. So, how come? Because usually bacteria competes with fungi, and usually bacteria wins. But if you are immunocompromised and you've been taking antibiotics for too long, your bacteria die and your fungal infections starts to manifest. So class, AIDS patient, yan, immunocompromised patient, they tend to have fungal infection. Yan. If you have weak immune system, you tend to have more fungal infection. Okay, so class, to be successful in microbiology, you need a microscope. Yeah. So for my freshmen, so if you have time, why not start memorizing the parts and functions of a microscope? Yeah. So class, next is parasitology. Yan. Parasites, class, are also microbes or microorganisms. We utilize the microscope to see them. But some parasite class are can be seen by the naked eye. Some are very big. Yan. So class, in parasitology, yun, we study parasites. Yan. Parasites usually compete or steal the nutrients of its host. It's steal the nutrients of its host, yan, or the food of its host. So ganun ang mga parasite here, class. So in parasitology section class, so the most common specimen that they bring in parasitology section class is the stool. Yeah. So it is the stool where we usually find this microorganism. But class, some parasites reside in the urine. Example here is Trichomonas vaginalis. Trichomonas vaginalis. Yan. Class, tama. It can reside in the vagina. Yes, you can find it in the urine. Ayan. So, Trichomonas vaginalis, class, is a sexually transmitted disease. Yan. So, ayun, class, it can then be passed from one person to another to sexual contact, and it is usually found in the urine. Ganun. Class, ang cute nito, Giardia lamblia. Yan. So, Giardia lamblia, class, is waterborne. Meaning, if you drank water with Giardia lamblia, you can have Giardia lamblia. So, the disease is giardiasis. Yan. Plus, here we have Strongyloides trichoralis. Yan. Plus, it's a facultative parasite. Yan. It can exist independently of a host. Pwede siyang maging independent. Yan. Some of this Trichomonas vaginalis class, it's a parasite. It cannot live outside the host. Yan. Obligatory parasite siya. Here, this is a lice. Parasite rin yan. So, ectoparasite siya. It is in the exterior surface of the host. Saan ba nakahanap ang lice? Diba? Class of buhok. Exterior surface. Yan. Plus, you know, this one, Isospora belli. I cannot forget this this egg. Class, you know, Isospora belli only comes out when you are immunocompromised. Yan. When I say immunocompromised, you have weak immune system. Who are the people who usually have weak immune system? Class, AIDS patient. Yun. So, a mother went to the laboratory and unfortunately, we found an Isospora belli in her stool. You know, we cannot, when I was an intern, no one can identify this except the pathologist because we don't really encounter this. We don't have a lot of AIDS patient. Ayun. So the mother already have AIDS pala. It's AIDS. It's not HIV. So it's in the fulminant form. Yan. So that's Isospora belli. Galing, no? So class, ayan, there's so much parasites to see. Yan. So do you know this, class? Diba? It's very common in the videos that spreads in YouTube. So this is Ascarisian. It can be seen by the naked eye. It's an adult Ascarisian. And the egg form of Ascaris ito, class. Yan. So this is a hookworm. Yan. So, ganun, class. Ascaris lumbricoides. That's how you spell it. So, class, I just want to show you this GIF. Ayan. Ano kaya to? Class, yan, this is a parasite which is attacked, which is warmed by your WBCs, specifically your eosinophils, class. Your eosinophils are your white blood cells which attacks your parasite. Grabe, no, class? Someone's fighting for you. Yan. I love our eosinophils. Ganyan, class. So, if you have Ebola in your system, ganyan, they will attack it. Galing, no, guys? Amazing. Yes. So, class, we have here blood banking or immunohematology. Yan. Blood banking or immunohematology. So, guys, in blood banking, so I think you're familiar with the Red Cross. So, under blood banking, class, there is blood donation. Yan. So, if someone donates blood, then we are the one. So before fusing it to the recipient, bago i-transfuse, class, sa nangangailangan ng dugo, we need to blood type it first. You know, it's very easy to do blood typing. And class, we need to cross-match it first, or compatibility testing. So class, so once we transfuse blood, so class, we need to do a blood typing, a compatibility testing first. Ganyan. So class, this is what your blood typing looks like. And hopefully one day, yan, perhaps if I go to the school, I will demonstrate how to do blood typing. It's very easy, guys. So guys, next is hematology. Yan, hematology. So hematology is the study of blood. Yan. So class, we will memorize here the composition of blood. And so class, notice. Yan. Notice, if you will centrifuge or separate your blood into two, if you will centrifuge it, if you will spin it, yan, 45% will be formed elements. Yan. And 55% is plasma. Class, plasma is the watery portion or the water portion of blood. Class, ang blood may tubig siya, ha? And it's 55%. Yan, almost for 55%. So if your plasma, yan, what are the components of plasma aside from water, which is 91%? Class, you have proteins in your plasma and you have other solutes. Yan. Tingnan niyo natin yung mga protein, class. Nandito, we have albumin, yan, globulins, and fibrinogen. Class, albumins are transporters, nagta-transport siya ng mga bagay-bagay, class. Albumin. Class, globulins, an example of globulins are antibodies. Yan. And fibrinogen, class, participates in clotting. For your body to stop bleeding, and so that you won't bleed out, aside from platelet, yan, fibrinogen participates in clotting. Yan. So other solutes, meron tayong mga ions, nutrients, waste products, gases. Yan. Regulatory substance like hormones. Yan. Sa pa-class yan. So here, in our blood, we have plasma. So this is the liquid portion of your blood. So class, so your plasma contains 91% water and we have 7% proteins. So we have albumins here. So your albumins are protein transporters. We have globulins. An example of globulin are your immunoglobulins or your antibodies. And we have fibrinogen. So fibrinogen participates in clotting, yan, with platelets. Next class, we have formed elements. Formed elements or cellular elements. So 45% of your blood consists of cell. Yan. So the most abundant cell are your red blood cells. So the most abundant cells are your red blood cells. Next are your white blood cells. The white blood cells. So class, we have 1, 2, 3, we have 5 types of white blood cells. Yan. We have this mnemonic. We have never let monkeys eat banana. Never let monkeys eat banana. So, class, nakaayos yan. Yung never, yung neutrophils, it's the most abundant white blood cells. So, 60 to 70%. We have lymphocytes. We have 20 to 25% monocytes, 3 to 8% eosinophils, 2 to 4% and basophils, 0.5 to 1% lang siya. Class, your neutrophils increases in cases of bacterial infection. And class, tumataas ang neutrophil natin pag may bacterial infection tayo. Example, class, you have appendicitis. Class, eosinophils, it increases in cases of parasitic infections. Yan. Lymphocyte, it increases in cases of viral infection. Yan. Monocytes, class, these are phagocytes and kumakain ng bacteria. And monocytes are the largest cells in the body. And basophils, class, increases during allergic reaction. Yan, allergic reaction. So class, your lymphocytes, we have two types of lymphocytes. We have T cells and B cells. Yan, T cells and B cells. So class, lymphocytes, yan, they are for your immune system. So your B cells will eventually become plasma cells and will produce antibodies. Yan, kaya saan ko nasabi, no? Isa pa. So class, in this next stage, I'm just going to show you the photos of the different cells. Yeah. So class, in this picture, this is a case, we have normal blood. So notice, the white blood cells are more numerous than your white blood cells. Yan. Normal blood yan. But class, in cases of leukemia, your white blood cells tends to increase in number. Class, the cancer of the blood is, we called it leukemia. Yan. What is anemia, class? What's anemia? When there is decreased red blood cells. Yan. So, decreased red blood cells, ang anemia, class, and in leukemia, it is the cancer of the blood. So, there is increased white blood cells. Okay? Kakalimutan nyo na. So, class, you know, she never let monkeys eat banana. So, class, neutrophil, here, these are neutrophil. So, they tend to increase during bacterial infection. In lymphocyte, they tend to increase. Yan. They are affected by viral infections. Yan. Viral infections. We have two types of lymphocyte. B cell, and T cell. Yan. T cell and B cell. Okay? So, class, your B cells becomes plasma cell. Class, yung B cell, it becomes plasma cell and produces antibodies. Yan, produce ng antibodies. Yan. Antibodies are the one that neutralizes your antigens. So, class, monocytes are the largest WBCs in the circulation. They are phagocytes. Yan. Eosinophil tends to increase when there is parasitic infection. Class, dapat ang color ng granules ng eosinophil, it's red-orange. Yan. And basophils, class, we tend to increase during allergic reactions. Yan. Kaya nyo yun, class. So, class, we have this immunology. Yan. Immunology is basically the study of the immune system. So, the body is discriminating self from non-self. Class, anything that is non-self, it is attacked by your body. Class, even in organ donation. So, last time, my example was Selena Gomez, right? So, Selena Gomez received a kidney. But class, it's the brand new kidney is still non-self. Yeah, non-self. Though there was compatibility testing, still it's non-self. So, in the long run, still the body will attack anything that is non-self, guys. So, yun. The immune system tends to attack anything that is non-self. Yan. It eliminates non-self components such as infectious agents. It eliminates new organs. Ganun. So, class, differences between, so, immunology and under immunology, you will study antigen and antibodies. Yan. So, class, your antigen, so they are your infectious agents. So, yung mga microorganisms, we have bacteria, virus, fungi. Yan. And the thing that that attaches, ito yung mga red, that neutralize these antigens are your antibody. Yan. So, class, some vaccines contains antibodies. Yan. So, pre-made antibodies. So, if you will get a vaccine, you will get brand new antibodies. Yan. So, antigens are foreign bodies, something that triggers an immune response. But, class, example are antigens from organ donation. Yan. Antibodies, class, particles produced by plasma cells which are activated B cells. Yeah. So we have 5 types of antibodies. Yan, we have gamed IgG, IgA. Ig means immunoglobulin. Immunoglobulin G, A, M, E, D. So class, if you notice, class, isn't it that they're talking about rapid testing? Yan, rapid testing. So when we talk about rapid testing, guys, what they are detecting are your antibodies. Ma'am, what specimen do we use when there is rapid testing during this COVID-19 pandemic? So class, what the antibodies they are testing specifically are IgM and IgG. Yan. IgM and IgG in rapid tests. So rapid test class, the specimen is blood. In the PCR test, in polymerase chain reaction, the preferred specimen is oropharyngeal swab. Class, masakit daw yun. Kasi you need to really insert it in the oropharynx. And class, it's important that the medical technologists collect ample amount of blood because of secretion, because the swab may dry out. Yeah. So class, I found this GIF. So guys, this is a plasma cell. Yan. So it has produced antibodies. Yan, the Y shape. Yan. Class, actually, we cannot see these antibodies under the microscope, ha? And class, also virus. You cannot see it under the microscope. Under a compound microscope, you can only see it using an electron microscope, guys. Electron microscope. Yan. So class, notice in this GIF, yan, the antibodies are neutralizing the coronavirus. Yan. Tayo na ulit. Yan. So guys, now we are in your clinical microscopy section. Yan. So class, this is where we study urine and other body fluids. Yan. So aside from urine, in clinical microscopy, that is where we deliver seminal fluid. Yan. Seminal fluid. Cerebrospinal fluid. Class, cerebrospinal fluid is the fluid in your spinal cord. Yan. And that runs in the ventricles of the brain. So, yan. Class, so urine. Class, stool is not in clinical microscopy. It's in parasitology. So, here in the Philippines, okay. Because perhaps you're going to read some references that stool is found in clinical microscopy. So, yan, urine, seminal fluid, CSF, actually synovial fluid too, the fluid that hydrates or cushions the joints. Excuse me. Yan. And class here. So one of the common tests in clinical microscopy is urinalysis. Yan, the analysis of urine. So we assess the physical and chemical characteristic, physical, chemical, and microscopic analysis of urine. So we look at the physical characteristics, the color, the turbidity or the clarity, the specific gravity. Class, we don't smell it. Yan. We don't taste it. Yan. We test for chemical components like glucose, presence of glucose. Yan. At marami pang iba, class. Microscopic analysis. Yan. So we can see different crystals in your in your urine. Yan. Class, sometimes sperm. Diba? Class, next, we have, so magkaiba na, clinical microscopy. Now, we are in clinical chemistry. Patikim lang to, class. So, what are the things that you are studying in clinical chemistry? So, you are studying the chemistry of the different chemical components in blood. Class, ang raming chemical components in blood. Yan. So, example, yan, we have glucose. Yan. So, this increases in cases of diabetes mellitus, We have uric acid. This component increases when you have gout. Yan. Gouty, arthritis. Yan. Class, what else? Lipid profile. Lipid. So, it talks about cholesterol. Yan. Cholesterol, good and bad cholesterol. We have blood enzymes. We have urea, creatinine, blood electrolytes, class, specifically if the baby is having diarrhea and the baby is dehydrated, so we have to test for electrolytes. Yan, in dehydration. We have hormones, class. Hormones, so we test for thyroid hormones, testosterone, estrogen, and class, and what's the last portion na tatakpan? Blood gases. Yan, blood gases. So when we test for blood gases, what we use is arterial blood. Class, from glucose to blood hormones, we use venous blood, the blood that flows in our veins. But in blood gases, the blood that we utilize, the specimen that we utilize are arterial blood. And nakalimutan yan. And finally, class, I think we're almost done with the sections or the major subjects, and we have histopathology. Actually, hindi ako nakalagay ng molecular biology dito, sayang. So we have histopathology, class. So histo means tissue, pathology means disease. So we are finding diseases in your tissues. Class, here in the Philippines, every time that an organ is taken from you, so because of surgery, so for me, class, I had goiter. So goiter is the enlargement of your thyroid gland. So eventually, class, lumaki na siya, it's not responsive anymore to medicine. So I decided to get it surgically removed. Yan, so natanggal na. So once the surgeon has removed the goiter, class, it will be sent to the histopathology. Yan. In the Philippines, it's mandatory that every time that you will lose, that a tonsil is removed, a breast is removed, ganyan, a uterus is removed, class, it will always be sent to the histopathology section. Ma'am, what will they do in histopathology section? I think you have heard about biopsy. I think that's the layman's term about testing if the tissue has cancer or malignancy. So biopsy, class, the technical meaning of biopsy is when you are acquiring a portion of a tissue. Yun, class. Biopsy is acquiring or taking a sample from a tissue. You're just getting a portion pag biopsy, guys. But in what I'm talking about, but class, biopsy, so after you took out a portion of the tissue, you can now take it to the histopathology section. So biopsies are performed by the doctor. So what I said a while ago was surgery. Yan. So the whole tissue was completely, the tissue was completely removed. Yan. So they will deliver it to the histopathology section. And what will they do? So the pathology, the medical technologists will process it, ipaprocess niya, process niya, i-sustain niya, class, and the pathologists will detect if there are abnormal changes in the tissues and in the cells. So this is where your terms malignancy and benign are derived from. So when we say something is malignant, yan, so yan, the tissue is malignant. Ganyan. So there is cancer, there are abnormal cells. Yan. So cancer are the growth of abnormal cells. And class, when we say benign, so there's no cancer cells. You know. Ano pa? Class, isn't it that we discussed George Papanicolaou? Yan. So George Papanicolaou discovered the pap stain, yan, the pap smear, diba? So the smear, yan, so they will acquire cervical cervical specimen. They will place it on the slide, and this smear class will be brought to the cytopathology section. Cytopathology. So cytopathology is related to histopathology. So when we say histopathology, it's the study of tissue. When we say cytopathology, it's the study of the cells. Ayan. Cells lang kasi nakuha sa cervix class. I hope I'm not confusing you. So in class cytopathology, ayun class, once they get the cervical sample, the pathologist will also diagnose if there is malignancy or if the sample is benign. You know. So Papa Nicolau is under histopathology section. Okay? Yan. So class, sarami natin napag-usapan for the day. So these are just our services. I just want to reiterate just a summary before we go. Yan, kundi na lang. So class, here's our job. Yan, examination of tissues, excretions, class, human body, excretions of the human body and body fluids. Yan. We have blood banking procedures and techniques, so our immunohematology procedure, parasitologic, mycologic. Anong mycology? Mycology or mycologic? Mycology is the study of fungi. Histopathologic and cytotechnology or cytopathology. Pareho lang yung class, so magkasama sila. Clinical research, class, that's our service. Class, ito rin, no, ang wide ng pwede nyong gawin. Prepare and standardization of reagents, standards, stains, and others. We have clinical laboratory quality control. So we maintain quality. Yeah, maintain quality. So we make sure that our results are accurate, are timely, are precise. Class, we collect and preserve specimen. So class, all of these services are under your RA 5527. We are protected by the law. And class, of all of these things, we are the only profession who could do it. So there is no overlap to other professions. There's no overlap to other professions. So what else? Role of medical laboratory science play a pivotal role in the promotion, curative, and preventive aspects of a nation's health delivery system. So treating patients and monitoring their response to treatment. So we aid in doing this. Monitor the development and spread of infectious and dangerous disease, diba? Isn't it that the laboratory right now is very valuable, diba? With our swab test, with our PCR, diba? Galing rin. Sumisikat ng mga medtech class. Tapos back then, some were saying that medical technologists were not frontliners. May ganung issue noon, pero ngayon frontliners na daw tayo. Backliners daw tayo nun. Now, class, we have deciding effective control measures against major prevalent disease and deciding health priorities and allocating resources. So, class, medical technologists can work outside the lab, class. Diba? You can be working in DOH, class, whatever you want. Work in PhilHealth, class. Okay, then, juju ko lang yung sarili ko, class. So, medical technology is a person who engages in the work of medical technology under the supervision of a pathologist. Yeah. So, class, our boss, the head of the clinical laboratory, is a pathologist. But, class, in cases or in places where there is no pathologist, yun lang that's the caveat. You can be supervised by a licensed physician authorized by the Department of Health in places where there is no pathologist. Yan. So you should have passed the Bachelor of Science in Medical Technology. Class, this is in RA 5527. So now it's Bachelor of Science in Medical Laboratory Science. So RA 5527 to. So class, according to RA 5527, so the practice of medical laboratory science, we do routine laboratory tests and advance, apply problem-solving strategies, yan, the different activities, conduct community-based research, Provide professional consultancy. Class, dito kayo yaman. If you will be a consultant. Yeah. Okay, what else, class? So, a pathologist is a registered physician. So, they should have passed the board of pathology. Yan. So, yeah. So, that's the end of our discussion. Ma'am, you haven't discussed about medical technicians. Yeah. So, medical technicians are the ones that assist us in the laboratory. Apparently, they only got 74% in the board exam. Yeah, so I think that's the only time that you will be a medical. Please confirm that. Actually, hindi ako masyadong sure doon. But they did not completely pass the board exam. Yun ang pagkakaalam ko sa mga medical technician. Yan. So, end of our discussion, class. So, if you have any questions, please share it to the class so that we can answer it together. Okay? So, that's our discussion for the day. Thank you, guys.